Hi guys, for those of you who don't know me, my name's Jenny. I graduated from the MLS program last May. Stephanie reached out to me and told me she was doing this special lecture for you guys because there's a handful of you who have decided not to do the clinical internship and also aren't pre-med or pre-PA. When I was a junior, I was in the same boat. I originally wanted to pursue a graduate degree, but that ended up not panning out, and then I was faced with finding a job after graduation without my MLS certification. Some tips that I've learned along the way is that internships are really crucial. It's a great networking opportunity. I applied to the summer laboratory science program at the Mayo Clinic in Rochester, Minnesota, and was fortunate enough to get an internship out here between my junior and senior year. I worked in an antibody immunology lab where I learned what it was like to work in a clinical hospital setting. I also learned about a lot of other jobs that are similar but don't necessarily require an MLS certification. And like I said, the networking opportunities were really incredible. I would definitely recommend getting to know all the people you work with. I met my current assistant supervisor because she worked in the lab down the hall and we shared a break room. So what ended up happening for me was when I graduated, I was offered a job out here at the Mayo Clinic at the Human Cellular Therapy Lab. We do all the stem cell and bone marrow transplants for the clinic. I'm also currently cross-training in the research and development side of the lab, which is a great place to work if you don't have an MLS certification. My lab in the research and development lab does all the clinical trials for the clinic that involve stem cells and dendritic cells. I'm currently working on one for hypoplastic left heart syndrome, where we harvest stem cells from the umbilical cords of infants who have been diagnosed with HLHS when they were still in utero. We process the stem cells and then give them back to the patient when they have their open heart surgery at 4 months. So that's a really cool opportunity. I know lots of labs in the Boston area, if you guys are planning on staying close to UNH, also have research and development portions. That's a great place to look for either internships or jobs. There's a lot of other job opportunities too, analytical type jobs at pharmaceutical companies like Teva or Lonza. Also great places to work. If you guys have any other questions for me, you can email me at jah934@wildcats.unh.edu or definitely connect with me on LinkedIn. I hope to hear from you guys soon, and best of luck.